Hello everyone, Pharma will welcomes you all busy people to yet another learning video. In this video, we will learn about the IPCA Laboratories 483 observations. So as you might be aware of the fact that a couple of weeks back, USFDA has issued Form 483 to IPCA Laboratories Pipria Silvassa plant, which is located in the Dadar Nagar Haveli. So I hope those who are working in the USFDA approved plants, they might be aware of this. So well friends, Pipria facility of the IPCA laboratory was inspected in the month of April from 18th of April to 26th of April 2023. It was almost 7 days audit if you exclude Saturday and Sunday. So there were two auditors who conducted the audit and their names were Rajiv R. Srivastava and Kalia N. Hicks. So guys, these two auditors has given total 3 number of observations. So let us understand all these observations one by one. Observation number 1. There was a failure to thoroughly review any unexplained discrepancy and the failure of a batch or any of its components to meet any of its specification whether or not the batch has already been distributed. So well friends, under this observation, auditors has gone through the OOS, OOT and market complaint investigations. So they were not satisfied with the investigations which were carried out for the investigation of OOS, OOT and the market complaints. So for example, auditors has reviewed this OOS number investigation and they observed that for this OOS investigation, written procedure was not followed. Well friends, auditors found that this OOS was logged for the lower side assay result. So no root cause was identified from the phase 1A investigation, and thereafter phase 2A investigation should be done, and then phase 2B investigation should be done as per the SOP flow. But for this OOS investigation, phase 2A manufacturing investigation was not done and directly phase 2B investigation was done, which was against the SOP flow. So along with this, auditors also commented or mentioned that this OOS was invalidated without providing scientifically proven root cause. Similar observation was given for this OOT investigation report where SOP procedure for the investigation was not followed and no scientifically sound root cause was identified. So these were the discrepancies related to the OOS and OOT investigations. Now let us understand another example mentioned under observation number 1, and this example is related to the market complaint. So guys, auditors observed that on 24th of November 2022, a market complaint with this number was logged for the presence of the spots on the tablets. So this market complaint was not related to the US marketed products. So for this market complaint, investigation was carried out and it was observed that firm has not identified the root cause adequately. According to the investigation report, manufacturing was carried out in grade D area and HVAC system was qualified. However, auditors stated that your firm failed to document the evidences in the investigation report that how your firm ensures adequate exhaust system to control the contaminants in the area where the contamination can occur during the production. Additionally, your firm has failed to rule out the possible contamination from the HVAC system as your firm did not evaluate data to verify the room classification for the grade D. Now comes the observation number 2, and the title of the observation number 2 is the responsibilities and the procedures applicable to quality control unit were not in writing and fully followed. Well friends, under this observation, auditors stated that your firm failed to ensure deviation investigation and associated corrective and preventive actions are accurate and contemporaneously documented. So let us see the examples mentioned by the auditors in Form 483. So there was a deviation number PR206678 which was logged on 20th of July 2021. And this deviation was related to the tablet inspection system was not working. So guys, auditors observed that this deviation was not closed for 10 months and there was no justification documented for the delay in closure. In another example, auditors found that kappa number 194953, which was associated with the deviation PR18513, was not implemented and closed for 7 months. So in another example, deviation investigation PR185131, which was logged in the track wise on 12th of December 2020. However, once the documentation began in the track wise, After 2 weeks, a new due date was documented without justification. Now comes the observation number 3, and under this observation, auditors stated that your firm has failed to establish an adequate quality control unit with the responsibility and authority to approve or reject all the components, whether it is drug product, containers, closures, in-process materials, packing materials, or labeling, etc. So, under this observation, auditors also stated that your firm has failed to initiate or close corrective and preventive actions which were related to the data integrity issues. For example, auditors found that for one of the equipment, HMI was not having audit trail. Along with this, auditors observed that one of the change control which was initiated with number PRID 258680 on dated 5th of December 2022 was still open. And one more interesting finding mentioned under this observation, let us see what was that. So during the walkthrough of a microbiology laboratory, auditors reviewed the logbook of daily calibration verification of the balance. So what they observed that daily calibration verification record printouts were not readable, and same were signed by the microbiologist, microbiology supervisor, and the quality unit. Auditors specifically mentioned that on 16th of March 2023, the logbook was signed and approved by the quality assurance and the data was not fully readable. No action was taken to rectify the problem, and the balance was under maintenance by the manufacturer, who also printed a non-readable document from the balance and signed off without acknowledging the deficiency. So finally, auditors concluded that the preventive maintenance program of the firm and the good documentation practices of the firm were deficient. Lastly, in the end of the Form 483, you will find this statement given by the auditors, which says that your firm has failed to document the start time of the remediated deviation investigations. Therefore, the length of the investigations is unknown and unable to controlled by the quality unit. So guys, these were the 3 observations which were issued by USFDA to IPCA Laboratories Pipria facility. So whatever the examples mentioned in the Form 483, we have understood all of them. If you still want more details about these observations, then you can check the link given in the description, or you can visit USFDA website to download the Form 483. Well friends, after understanding these observations, my evaluation says that this audit of IPCA Laboratories will be concluded either VAI or NAI, as there were data integrity related issues. If any update comes in this regard, I will update you. So this is it for today. Hope you have learned something new today. Bye bye and happy learning.